Inadequate access to improved sanitation disproportionately affects women's and children's health and well-being. Women play a crucial role in the management of household water supply, sanitation, and health. Where one toilet is shared with more than 2 households, mainly in informal settlements, women in particular are at a disadvantaged position in Kenya. Poor toilet facilities without adequate water increases health risks. Presence of animals and insects creates anxiety and fear and lack of privacy. When a private act like defecation is made public through shared toilets with many households, it gives opportunities for multiple abuses, bullying, shame, physical and sexual assault, inappropriate touching, and other non-consensual sexual acts, including rape. Despite these challenges, women adopt various strategies such as avoiding the usage at night, using buckets or plastic bags for urination and defecation, going through psychological stress and family burden. The persistent failure to meet the sanitation goals suggests that our understanding of the practices and their utilization, especially among women, is limited. This documentary captures the real-life experiences of women in Nakuru City.
Nakuru County, just like any other county in the country, is suffering out of water scarcity, whereby the most affected population is women and children. Our current coverage for water is about 66%, and for sanitation is about 17%. That means that there is a percentage of people living in Nakuru that do not have access to water a distance of more than 1 kilometer. They have to fetch water from more than 1 kilometer.
Most of the time we have no water. That makes it difficult for me to be able to access sanitation properly. It made me to have a pit latrine, so that when I have no water, I can easily use the pit latrine.
Tunaishi kwa nyumba rent, tunaishi watu 7 kwa ploti, ni nyumba 7. Single bedroom ni 1, alafu double bedroom ni 2. Tunatumia choo moja kwa watu wote.
Due to the recent drought, many surface water sources have dried up, leaving very few areas with adequate water.
Hii place tunaishi watu 7, but watoto ndio wengi. So ikifika wakati wa kutumia choo, tuko na shida. Lazima tupange laini, lazima tugombane juu usafi, watu wengine wa maintain usafi.
Very few areas have been mapped to have good quality water, and these areas are also facing some challenge of encroachment, so we have lesser area where we can get quality water for provision. In sanitation, we also have the same challenge, and water is highly directly related to sanitation.
Outbreaks of diseases like cholera and skin diseases have been witnessed due to sewage breakages and lack of clean water.
There was an outbreak of the sewage. So our estate was really dirty because the sewage was everywhere. Children were not allowed to go outside because you see there were that outbreak of cholera. Some children were having skin disease because of that sewage everywhere.
Molili Suleha is a resident of Kambi, Somali in Nakuru. She explains the challenges she went through during her pregnancy.
Kama mimi wakati nilijifungua nilikuwa nanyesha sana. So ika happen inabidi niende choo kwa nyumba, nilikuwa natumia ndoo, juu siwezi tumia choo. Mwanzo nilikuwa na bleed sana juu nilifanya CS. So unapata hata kutoka kwa nyumba kwenda hadi kwa choo ni shida. Hiyo kinonda ilikuwa uchungu. Wenye tunatumia nao choo pia ni wachafu. Mtu anachapadi kwa choo, aflash uchafu yake. So unapata tunapata infection. Mimi kwanza nilizani nipate infection juu hizo pads. Hizo pads zikijaa inabidi tunachoma juu hatuna place ya kutupa.
The county government of Nakuru has embarked on sensitization programs that will see women and school children trained on the importance of proper sanitation.
So at the county government of Nakuru, we acknowledge the challenge, and we have done several interventions to reduce these issues. One of them being drilling of more boreholes, though we have a challenge because of the quality of water, underground water in Nakuru, which is highly loaded with fluoride. So it leaves very few sources that are reliable. And also another challenge is drying up of surface water sources. So the main source of water for Nakuru County is surface water. The groundwater sources that we have drilled are also experiencing some challenges because of the drought and the dry periods, whereby the water level, the aquifers are going down, and therefore the amount of water that we are able to obtain from these sources is going down. Very few areas have been mapped to have good quality water, and these areas are also facing some challenge of encroachment, so we have lesser area where we can get quality water for provision. In sanitation, we also have the same challenge, and water is highly related, directly related to sanitation.
Sanitation and water go hand in hand, and the county government of Nakuru is committed to ensure that its residents get better services on the same.
I'm requesting for the authorities to be able to look into the water shortages so that we can access to water. And also they connect us to sewer so that our challenges are limited.
Tungeomba watu wa HEL watufanyie tu jambo, watusaidie, hata watujengea hata kancho 2 ama 3.
I would like to request at least we get new basins in our compound, even in our estate, so that we will be able to get easy and clean toilets.
I thank the community health volunteers in this area because they come educate us about sanitation, how to keep our toilets clean, how we can use our toilets. They are very active in that, and so we thank them because of what they are doing, because they are promoting health in this area, and that has helped us a lot.
For NAWASCO, we have taken it up as our responsibility to make sure that we've been able to develop a gender and inclusion policy and implementation plan, whereby we are going to bring the women, the girl child, and the marginalized groups on board and ensure that their needs, we are able to, before we do any project, we identify their needs. What is it, for example, for the girl child, what is it is required in relation to wash? What type of facilities are required? For the women, for the pregnant women, what type of sanitation facilities are required to meet their needs, so that whatever project that we do, whenever we have any donor funding program, we have to take all this into consideration.
We have embarked on a program for sensitization of women and children on proper sanitation. This sensitization program is not only being done in households, we are also doing it in schools, whereby kids are trained on how to use toilets in an efficient way. And we are also having a program whereby we are harvesting rainwater for schools to utilize in these sanitation facilities. We have another program whereby we are giving subsidy for construction of toilets. For every door of toilet that you have constructed, we give a refund of some amount, 20,000 shillings per door. So that this is to help people embrace the need to have proper sanitation. We have been working closely with the public health department to ensure that every household embraces the need to have proper sanitation facility. We are also doing cheap sewers, where we do a sewer line that can be able to handle several households without necessarily doing the conventional ones, which are a bit expensive. So currently we are doing condominium sewers. These condominium sewers, the network is done up to the household level. There is also a program for social connection, where in case you are not able to raise money to do a connection to an existing sewer line, we give you some money in advance, and then you pay as you pay the water bill. This helps people to be able to connect to sewer and also to water.
The issue of good sanitation will also make us live at peace, and also our health will be good if the environment is clean and there's clean water and then the toilets are clean.
But if they are dirty, then our health is also at stake.